some people logging on. So wanted to thank everybody for taking the time this afternoon. We were pretty excited to bring Dr. Oldani to campus, and when he asked if there was a way to highlight the work of his office and the team that has been situated in that office, it was an instant yes from our office. I think one good thing to know is that I believe, and Dr. Oldani, correct me if I'm wrong, but your office and the effort is coming up on its 10th year anniversary, correct?
That does sound right. Yes.
Okay.
We can defer to people like Jess Kruger too, who probably can confirm that. Yeah, I'm getting a head shake. Yes.
Okay. Okay. Well, over the course of that time, I think the reason that we're here today, it's a very important conversation to have because the group who has been working on this effort, from an interprofessional practice and education vantage, they are a very strong team, interdisciplinary across, our health science schools and across the university, and originally led by Dr. Patricia Otaki, who is an emeritus faculty member in the School of Public Health. And in a very short period of time, they have truly distinguished UB in this space. Countless awards, national recognitions, and have really blazed a path in what this could be as far as a model for other institutions. And so it's great to see the work that they've done. And I also want to say that many of them are doing this above and beyond their day jobs per se. So everybody is wearing multiple hats, and so their contributions are very, very much appreciated by all of us. And just this past year, we were fortunate to push out a national search, and Dr. Oldani actually joined us as the full-time director of the office. And he has a background. He did undergraduate work and master's work in Milwaukee, and then also did his doctoral work at Princeton. And we were very, very excited to be bringing him here to campus to lead this effort. So with that said, Dr. Oldani, I'll toss it over to you, and thank you for taking the time to do this with us today.
Yeah, my pleasure. Thanks for that awesome introduction. I've got several members of the team here. Just a note to the group, I'll be on till about 12:25, and then I had double booked another IPE presentation. So I'll be hopping off, but if there's questions that are emergent as we go through our presentation, please throw them in the chat. We'll keep the transcript and we'll definitely follow up with you. And also the various team members here can answer things at the end if there's some time. And thank you again, Jill. Your team's amazing, and we really appreciate this opportunity. So this is our team here at University at Buffalo. Several people are on today that are members of this team, but you can see, you can find all this on our website. So if you just search Office of IPE at UB, you'll make it to this page, and we have an incredible collection of faculty and staff. I want to point to Lena Vinder, our program administrator. She's just been great to work with. She's helped onboard me in a really efficient way, and very open to helping me learn UB and the IPE Pathway. So thank you, Lena. And she's here today helping behind the scenes. And let's just see if there we go. Oops, sorry. There's a little delay here. So just a quick review. I know many of you are familiar with IPE, and you probably heard a lot of discussion about silos, but just moving forward, IPE can start at a very basic level, 2+ caregivers on a care team. And I'm taking this definition from the World Health Organization in IPEC 3.0. I'd refer anybody interested about more or diving deeper into IPE to go to the Interprofessional Education Collaborative. You can search that out. And, the UB program is around 10 years old. If we go back a little bit further, IPE is really part of this kind of reboot of the patient-centered, client-centered, person-centered movement that started perhaps 15, 20 years ago in medicine, kind of thinking about that triple aim as well. And the hallmark is how those care teams act. And really, you'll hear words like intentional and shared decision-making, and kind of production of care plans. And if you have that happening, whether you're at a drug court treatment team, or you're at a VA or a federally qualified healthcare clinic, or an ambulatory care clinic, or a surgical team, you're engaged in IPE. And I would really encourage people if you're using terms like interdisciplinary or multidisciplinary, but you see what I'm putting together here, often you are engaged in interprofessional work and activity, and I would, encourage you to make that switch in terminology. The classic, I'm from Wisconsin, so of course I had to throw up a red barn, is kind of moving from these hierarchical silos that you see here, to, of course, more uh, collective, collaborative way of engaging. And all these silos here, I like the symbolism, are connected. And we really kind of take that metaphor and put it into action here at UB. And will my screen, there we go. So this pathway here, the Interprofessional Practice and Pathway, is a partnership with UB and Canisius, and we have Amy Larson here today. I'm really happy about that. 15 schools and programs. It's really kind of a remarkable pathway that was put together 10 years ago, as Jill mentioned. And all these partners come together really with an emphasis on patient care and improving community health and wellness. What is the importance of IPE at UB? I'm kind of giving this broad overview, and I think you'll see with some of the examples of the team coming forth that we really do achieve some of these, all of these important goals, I should say. So number one, we want to secure program accreditation requirements. IPEC 3.0 are a new set of competencies I don't have time to elaborate on, but there's now 23 health and social care professional organizations that work towards meeting what we call interprofessional competency requirements. And I'm happy to say we had an AT accreditation visit here this in fall, and we scored very high when it came to interprofessional. They're interprofessional standard, and we've been working with the dental program on their accreditation coming up this fall. So that's one of our roles here at the Office of IPE, to really ensure and secure accreditation. More broadly, IPE really started with the idea of improving patient safety or client safety, reducing medical errors, and that's really been borne out in the literature. I'm pointing towards this cadet scoping review article. I'm happy to share that with anybody who would like to see a copy of that. Just email me. But it's really clear that when you engage in IPE for your learners, you can track downstream improvements in patient outcomes. And that's really important. And that's been borne out through this movement over the last 10 or 15 years. I think something that's emerged post-pandemic that's equally important is the emphasis of care teams and having care teams function in a way that improves workplace wellness. And I think that's starting to show in the literature, and it's an area for, I think, research as well. And as Jill laid out so nicely, UB, the Office of IPE at UB, is really has a national reputation as a site of innovation and scholarship. And if people have some light bulbs coming on as you hear what we're doing in IPE across these various programs, we're going to have a sampling of that today. Please reach out to us. I have, for example, medical students who've reached out to me and they want to engage in some scholarship related to IPE in our programming. That's just one example, and I was happy to help them move forward with that research. So we're not going to have a full review of IPEC, but I'd say the overall goal that I like to stress with students is that we want to produce better nurses, PAs, doctors, pharmacists, and so on. All of our programs in school represented here through the building of interprofessional competencies. And these are the 4 major competencies that we emphasize here. There's 40 to 50 sub-competencies we won't get into today, but that's really our goal. And we have a learning model that we adhere to based on IPEC 1.0, which is exposing our students to IPEC competencies or interprofessional competencies, creating avenues for immersion, and then really building competence. And so it's a step-by-step process that we engage in here. And if we look at the numbers, this is one of the things that really impressed me about UB and Canisius, our partnership. If we just look at 2024, these are the numbers of students enrolled in our various programming in 1 year. So around 3,100 students involved in our programming. And that's a testament to building a really strong infrastructure, having buy-in from the deans and administration, and really placing or hardwiring our IPE curriculum creatively into the curriculum of each program that participates. This is a bit of a complicated slide, but if we look at this pathway, what we're really emphasizing here for students, for our learners, is requiring them to participate in our pathway, but really pushing them to achieve distinction. And what do I mean by that? So if we start here with Friday Night at the ER, and I'm going to talk in general terms, not all of our programs participate in every IPE event, but the majority do. So if we talk about Friday Night at the ER, many of our students start here with an introductory program to IPE. It's a very strong program in the fall. And then if we trace this bottom set of images I have here, all students participate in our fall and spring forums where they are exposed to IPE, they complete modules. Then we have opportunities for the majority of our students to engage in team steps simulation, which really stresses patient safety. They do that here at the Jacobs School and the Bailing Center. And then we provide opportunities for students to get outside the classroom. And I'm just putting one example of that, the Western New York Blood Care Center. We have a series of programs where students do co-curricular work. They interact with patients often in kind of a healthcare care plan setting. So if I go here with my mouse, this is the bulk of our required kinds of programming with one example of outside the classroom work. We've tied all of that, and that's what's really innovative about our pathway, to a micro-credentialing badge program. And I'm being aware of time. I've got a couple more minutes and I'm almost done. So the majority of students who complete the spring and fall forums, they can receive a digital badge. Same with students who can complete team steps. And then this health practice care badge are for the students that even take it a step further. And for example, in the public health department, those students don't complete team steps, but they have another opportunity for their students to receive this badge. And when our students on the pathway complete all 3 micro-credentials, they receive the full micro-credentialing certificate. And if you're not familiar with digital badges, it's a live link for students. And it's very popular with this generation of students where they can provide proof to what they've done in terms of collaborative skill building, interprofessional competency building to residency programs, fellowships, and future employers. And as I get closer to wrapping up here, hopefully there we go. We have a really high success rate with these digital badges. So if we look at last year's numbers, we're tallying this year's. The first 2 badges, 1,200 digital badges awarded to our students in this pathway. They like securing those badges. And we're really working on that 3rd badge opportunity for students where we have criteria for them when they're on their clerkships or clinical rotations to achieve that 3rd badge, to engage in more interprofessional competency building alongside with other opportunities like the Western New York Blood Care Center opportunities I briefly outlined. What's nice is the people, and I should say my team members, presenting next will spotlight some of these opportunities for students. So we're going to shift now to giving you some examples of what we're doing specifically through programs and how they're collaborating across these various programs. And I'm going to hand this over to Ryan in athletic training.
Right. Thank you. So as Dr. O'Donnell just said, my name is Ryan Krzyzanowicz. I am the program director for the athletic training master's degree here within the School of Public Health and Health Professions. So the first slide that I kind of have here is on back to school physical days and back to sport physical days. So I took a different approach on this, a little bit of trying to take a lot of photos at clinicals and things that we do in the community. And students may not always like that, but we have a reason of why, right? So we focus a lot on the community partnerships. And one of the major ones we partner with is the Lighthouse Clinic with the medical students, public health students, pharmacy, dental, nutrition students, and I'm probably forgetting more that have been involved in this, but we have a free back to school sport physical day. We've held it at the Seneca Babcock Community Center and UB South campus this year. So this is our third, we just finished our third year. And we've performed about just a little over 200 free physicals for community members that may not have been able to afford or have access to a provider to go to school, play a sport. And they're mainly elementary to high school students, but we've had people back to work physicals for jobs out in the community as well. We really emphasize communication, teamwork, and making that impact on the communities that the learners really live and work in, right? So we can count this as digital badge 2 and or digital badge 3, but usually digital badge 2. And I'll say data from this event has also been presented by and published by both faculty and students at national conferences. And a lot of people may not know what athletic training is. We became more popular, unfortunately, after Damar Hamlin's commotion cordis cardiac arrest event in January 2023. Those athletic trainers that did and performed CPR and used an AED on Damar to save his life, right? So in partnership with Dr. Les Bassan from the medical school of UBMD Orthopedics, the American Heart Association, and the Buffalo Bills, all of our students in our master's program and faculty become American Heart Association instructors. And in that, since the summer of 2023, when we started this, we now have students from medicine as well going through the American Heart Association training. And these students go out into the community to teach these life-saving skills. So since summer 2023, when we had our first event, the Juneteenth event, we've trained over 18,000 community members in hands-only CPR. So you can see Dr. Bassan up top left here, myself and Sarah, one of our faculty, at a Bills event that we did, and the Buffalo Bills home opener here, as well as some of our students out at different events within schools, school districts, and other community events. And all of this is organized from some grant funding that we've received as well. So again, data from these events have also been published and presented at national conferences. And the last thing that we really emphasize every Memorial Day weekend, our faculty partner with faculty from emergency medicine to provide medical care at the finish line for the Buffalo Marathon. What makes this experience a little unique is that we now have learners in our master's degree program in athletic training, but emergency medicine residents and fellows, as well as primary care sports medicine fellows. So they're a different stage of learner in their curriculums, right? They're credential providers. So what different parts of their career. And again, we focus on communication, teamwork, and trying to deliver that high patient care. But we partner with emergency medicine, AMR, ambulance, and actually the Buffalo Fire Department to take care of about 5,000 to 8,000 runners, depending on the year. And in emergency medicine, they aren't as used to planning a large scale event like this. So we've partnered with Dr. Clemency from emergency medicine to really try to figure out the best way to run a large scale medical event. So you can see in some of these photos here that we always have bottom right here, we have a medical timeout that we're going over roles and responsibilities of that profession. And then we break the learners into interprofessional groups. So there's a fellow, a resident, a paramedic, and an athletic training student in a group, and they take care of their patients in their pod. And you can actually see in here, a few summers ago, this was a rectal temp for heat stroke. This person had the highest ever recorded in Buffalo and lived. That person was 109 degrees before we did cold water immersion on them. But you can see the team, and each has their role and responsibility within these tubs here. So again, we count this as our digital badge number 3, and something we always look forward to on that Sunday of Memorial Day. So with that, I'll pass it over.
All right, let me see here. Do I have access to? Okay, perfect. All right, thank you. So I am Michael Brown. I'm the Assistant Program Director of the Physical Therapy Program, and I'm just going to take a few moments to share with you a little bit about our program and how we're involved in the IPE process. So like many programs, health-related programs, oftentimes there are accreditation standards that we have to abide by. And I'm happy to say that the physical therapy program has been a part of the IPE program since its inception. And it's in large part because, we have to not only teach many of the concepts related to the IPEC competencies, but we also need our students to participate in collaborative practice events, right? Or interprofessional collaborative practice. So we have We participate in all of the IPE offerings, but then because our IPE curriculum is included in a particular course within our curriculum, we also do a number of additional experiences. So some, like you already saw, Friday Night at the ER is one, but we also participate in Saving Alice, which is an amazing experience where medicine, pharmacy, PT, and some other programs get together to talk about medical management of a patient. There's a number of experiences as part of this course in our second year of the curriculum where we have individual intraprofessional. So again, we do some stuff with the PTA students from Villa Marie, but we also work with Canisius and the PA students, and we also do some stuff. Actually, our most recent addition to our offerings, we had some physical therapy students work with some medical students on instructing them and assisting the instructors with a physical exam for orthopedic conditions. So, great opportunity for our students to, work with other health care professionals as they're going through and learning about providing healthcare for their patients. So again, and we're always looking for new and innovative ways to continue to offer, these types of experiences to our students. Now, one of our goals, we've actually gone through some revisions to our mission and our vision within our program, and we're actually coming up for reaccreditation in a couple of years, and we're starting to look at ways that our program can change to meet the needs of society. And one of the things that we are really looking to do moving forward in the future is trying to find community partnerships where we can begin to engage with the community and providing some practical hands-on experience, not only for our students, but also providing services to the students or to the community members. And so we've actually been in some discussions among the faculty, and we've identified a number of opportunities here at UB, and you'll hear some of these later, like say from Dr. Kruger. But the point that I'm making here is that we're really looking at trying to find alternative ways to introduce interprofessional and interprofessional collaborative practice. And one of the things that we've discussed as a faculty is looking at the development of a pro bono clinic. And if that's not successful, then finding ways of engaging with other community clinics so that our students can participate in those experiences. And then finally, from a research perspective, one of the things that I'm very fortunate to have a few faculty members now on board who have an interest in interprofessional collaborative practice and just taking, what we're doing currently in the clinic or in the classroom and seeing how it's impacting the performance of physical therapy students out in the real world. And so we're thinking about how do we develop methods and ways to measure that impact that our current offerings at UB are having on our students, and is it making a difference in those health outcomes? And so I'll keep my section brief, and I'll turn it over to Amy Larson.
Hi, everybody. Thank you for welcoming me both this afternoon and in general for this program. I think should be able to, do I have control? Yeah, here we go. So we were very fortunate. I am the founding director of the physician assistant program at Canisius University. And I started developing this program in 2018. And as Mike alluded to, most programs, we have a pretty substantial IPE element to our accreditation process as well. And, Dr. O'Donnell alluded to IPE can be two professions, but I recognized early that in order for our students to really gain the valuable experience that they need to be, clinicians in the future, they really needed to be engaging early with other interdisciplinary learners. So, I think I lost. Somehow I lost the share slides. Can you still see slides? Nice. Yeah, I don't know where that went. Anyway, so I approached Dr. Otake at the time in 2019. We got together and we talked about how Canisius can be a good partner to UB and vice versa. I knew the reputation of the IPE program at UB. And so, we came together and thought about how we could be, effective partners for each other in this process. So attended the in-person forums when they existed back in 2019, really started thinking about the other programs that are offered. And one of the commitments that I made was that our students would actually be required to attend every badge. And we assured that by making each badge an actual course within our curriculum. So our pathway to badge completion actually exists through the students begin in semester 3. Thanks, Lena. Here we are. So the students begin for us in their 3rd semester with badge number 1, and they attend the spring and the fall forums as part of that badge. We have been an early partner early on with development and modification of the Team Steps program, which is phenomenal, as part of badge 2. And then for badge 3, we created a very structured format for our students while they're in their clinical rotations, where they are required to attend any one of the examples that we provide to them for interprofessional collaboration. And they have to write a paper on each experience that they attend over the course of their clinical rotations as a way to really formalize and measure their learning for that 3rd badge. So we have, since we started our first cohort in 2021, every one of our students has received all 3 badges. So we've been really proud of that. So that's how it's not letting me forward. There we go. So one of the things that we are working in addition to, what Dr. Brown talked about is not only finding the ways for our students to engage in meaningful ways with the badges, but also to start creating collaborations outside of those areas. And we've done that. I think we talked about it a little bit already with pharmacy, with the Saving Alice event. We've been very fortunate to be part of that every year since 2021. We did a vaccine hesitancy simulation with the pharmacy school with our students, which was incredibly impactful for them. So we're always looking for ways outside of the formal elements of the badge and credentialing program to actually engage with our partner programs at UB. In addition to the pharmacy collaborations, as Dr. Brown already alluded to, we do the collaboration with physical therapy. It was important for us and has been from the get-go for me to try to create space here at Canisius for my partners there at UB. Anytime we can create opportunities for programs to come to our space or use our space and work with our students on an interprofessional collaboration, we welcome that. So the physical therapy simulation that we've been doing with them, we've been doing that for about the last 3 to 4 years, has been very impactful, and we have collected some really meaningful data from that, again, Dr. Brown alluded to some future research that we may be pursuing for that. Students respond incredibly well to this event. So, and then, one of the additional things that we've been talking about doing is really continuing to foster the opportunity that we have at Sisters of Charity Hospital in the area. I believe we are the only, if not one of the only programs in the area that actually has a true in situ simulation lab. So we have a grant-funded lab at Sisters on the 4th floor that is dedicated to interprofessional simulation. We go over beginning in March every year. We start going over every 2 weeks, and we embed with the staff, nurses, UB residents, medicine residents, their pharmacy fellows, staff respiratory therapists, anyone that can be in that space. And you can see a picture of an example of one of those events that we do, where the students get to not only feel that real world scenario, run it in an actual hospital setting, but have some exposure to the professions in the workplace before they begin their clinical year. So this is an opportunity that we really want to see if we can continue to expand on with our UB partners in their programs. In addition to the opportunities at Sisters, we continue to want to offer the space that we have here. And we also have had some conversations for continuing to grow our community engagement. Some of the things that athletic training and physical therapy already alluded to. We are already in the community doing our health equity weeks, our service, and trying to find some ways that the other programs that UB and part of this IPE leadership team can maybe join us in some of those community engagement efforts. But that's where we are. And again, very, very grateful to be part of this incredible team. And I will pass it on to the next presenter.
All right. Thanks, Amy. So I'm the pharmacy representative on this fantastic team. I'm an associate professor. I'm also an internal medicine pharmacist at Buffalo General, and I work with many students and residents there. So this is just a table depicting the various activities that we have our students participate in the interprofessional education pathway. So you can see that we're pretty intentional about requiring an interprofessional educational experience in nearly every semester of our students' didactic training. So our program is a 4-year program, and the first 3 years they are, in the school with us, and in the 4th year they're doing rotations all year out in the community in various places. So I would like to point out that we do a nice job blending live and virtual experiences. So whenever you're trying to coordinate scheduling for 500 plus students, some of our activities include upwards of 1,000 students. It's always hard to try to pull everyone together in a live manner. And so Friday night at the ER, Team Steps, and Alice's story are all events that we do live, which I think is nice to give students sort of that balance between the flexibility that, virtual learning affords, but also, that really valuable face-to-face time. I'd also like to mention that perhaps because we're pharmacy, we tend to be detail-oriented folks. My predecessor, I've been a part of the leadership team for about 2 years. My predecessor before was Nicholas Fusco, and he has been super active in generating scholarly work to disseminate the great things that we're doing around these programs. So nearly every activity that you're looking at on your screen right now, we've presented or published peer-reviewed works, disseminating our results and the impact of these activities, which I think is really great. I do want to draw attention to one activity in particular. You've probably heard, several of us talk about these activities, Team Steps, Friday Night at the ER. You might be wondering, what are these things? So I'm going to talk a little bit about Friday night at the ER. We typically have our early learners in the program participate in this activity. It's a commercially available board game. You can see it in the picture here. 4 to 5 students on a team manage a busy hospital for a simulated 24-hour period. The session format's down below here, but in short, they basically get introduced to the game, they play the game, and then we have a debrief. So we studied, the impact of this particular activity in fall 2022. So we used a self-reported measure that the students completed to assess interprofessional socialization and teamwork skills. This is the Interprofessional Socialization and Valuing Scale. We had almost 700 participants in this activity. Like I said, scheduling this many students for a live activity can be a lot, but thanks to Lena, we make it happen. And you can see the various programs that participated. And you can note that, great diversity in programs here. I wanted to share just some of the results. So, that scale that we had students complete pre-post, these are the various items on that scale. And so I just wanted to sort of draw attention to a few of the items. I have gained an enhanced perception of myself as someone who engages in interprofessional collaboration. So this was a 7-point scale that students were asked these questions around, 1 being not at all, and 7 to a very great extent. And you can see the pre-post change here was quite significant. Again, I've gained an enhanced awareness of roles of other professionals on a team. Again, significant. And this is really important because these are early learners, and it really helps sort of set the stage for their work on interprofessional teams and preparing them for collaborative practice. And if you just take a look at the total score down here at the bottom, you can see that overall across the board, this was, an impactful activity for our students. So, we, and when I say we, predominantly I'm referring to Nick Fusco, who championed a lot of this scholarship. We as a leadership group feel like we've done a nice job sort of depicting the impact that our activities have on a student's education. So, it's great to show that students' perceptions have changed around interprofessional practice and collaboration, but really that next step is translating that into practice. So, we hope that by educating students in this manner, these activities will translate into practice, but really, to show that in the way of patient care outcomes and improvement in those outcomes is really sort of, the holy grail, I think, in, interprofessional education. And so this was just a recent publication that myself, Nick Fusco, and a few other leaders around the country wrote, really imploring pharmacy preceptors to continue that intentional interprofessional education through the experiential portion of students' education, so that students can really see the connection of those dots, and then we can translate that into improvement in patient care outcomes.
I realized I didn't unmute myself. Sorry. Hi, I'm Laura Smith from the Department of Communicative Disorders and Sciences, and I'm the clinic director for the Audiology and Speech Language Pathology Clinic on South Campus. Lena, can you just move my slide? Thanks. So who are we? We prepare select graduate students in 2 fields of study, so speech language pathology, as well as in audiology. Our speech program consists of 2 full years, 5 semesters worth of clinical training and didactic learning. And our audiology program is about 3 years. Well, we're moving to a 3-year program. Right now it's 4. And we provide services within our clinic to all of Western New York, as well as outside of Western New York. And we've recently started to collaborate with psychology, which is really great. And our PhD research faculty are more driven towards clinical practice. So we're starting to have better research outcomes with clinical integration of research into clinical practice. All of our faculty who serve as clinical faculty in the department have specialty areas which we train our students in. And we're the newest group to IPE. And I think we've been here since 2022. I'm new to the leadership committee. My predecessor was Gretchen Bennett. She was our clinic director at the time as well. And it is a requirement for us to meet our CAA and ASHA accreditation standards in order for us to get our accreditation. So it's been wonderful that we've been able to join the IPEC group and learning more about all of our fields. And unfortunately, because we're housed in the College of Arts and Sciences, often we're not connected with all the medical components. So this has been a great opportunity for us to share what we do. And also, I welcome opening partnerships into our clinic. We have a really nice, large clinical facility that will offer opportunities for more intercollaborative practice. So what is our clinic? Our mission is to provide quality state-of-art evaluation and treatment for speech, language, voice, swallowing, cognitive skills, hearing, balance disorders across the age span. So we do see young children all the way through aging populations. But we also have really terrific partnerships with our community partners in Western New York through the various school districts, private clinics, hospitals, to which some of which I will go out personally and help supervise and provide support to area school districts. My specialty is augmentative communication, so often I'll consult with teachers as well as a whole team of PT, OT, speech, special educators to help help a child with complex needs develop progress in their goals. So it's really sometimes us going out into the community, but also we have to send our students out for externships. So it's really a great opportunity for us to collaborate with the community across Western New York, as well as nationally and internationally. Some of our students go back to their homes and hometowns and are able to get their externship placements, as well as we have a pretty large Canadian group of students, so they tend to get their placements in Canada. Next slide, thank you. Next up is Gina.
Good afternoon, everybody. It is a pleasure to share with you our activities in interprofessional education and community engagement at the School of Dental Medicine. Let me see. Okay, so our school, I just want to introduce you to our school. What we do there, it's ranked 9th in the nation, according to the NIDCR ranking. And we have over 430 students distributed from classes D1 to D4. And these students are actively engaged in providing quality and affordable dental care to the Western New York community at the level of the general dentistry and dental specialties. We have more than 150,000 annual visits to our clinics and sites, and Elise is going to describe some of those sites. And therefore, the School of Dental Medicine is the largest provider of oral health care in Western New York. So Elise Cronin, our Director of Population of Oral Health, is going to share with you our community engagement activities. Elise?
Thanks, Gina. Hi, everyone. So I'm going to start off by talking about our mobile dental units. The dental school itself has 2 mobile dental units. Our first van came into existence in 1995. It has 3 dental chairs, x-ray units, is fully functional. And our second mobile dental van, the ribbon was cut in 2022. This one is drivable, has 2 dental chairs, and was made possible through the funding of the Mother Cabrini grant. Historically, our vans have predominantly engaged with rural outreach, mostly communities in the South Towns, Chautauqua area, Jamestown. Over the years, we've also visited places like the Buffalo City Mission, Girard Place. We even brought it to Alumni Arena for our volleyball game, to a Spike Out oral cancer event, which was pretty exciting. However, due to funding, as well as recognizing the need right in our backyard, along with the issue of Buffalo lacking fluoride in their water for an extended period of time, we've decided this summer to bring the vans back to Erie County. So through the support, as you can see on this slide, from the Mother Cabrini grant, our latest initiative is to bring our vans to the Seneca Babcock community as one of our sites. And here we've partnered with the School of Public Health and Health Professions, and we've adopted a holistic interprofessional approach to healthcare delivery. So what we're going to do is at these service sites, partner with the mobile unit with the School of Public Health in providing preventative visits and services, health screenings, and then also coordinating continued care for these patients. I think there's a huge opportunity here, not just for providing access to care, but also for future research purposes as well. Next slide, please. And I also want to briefly mention some of our other outreach endeavors at the school. So we have our annual Dentistry Smiles on Veterans event, which we provide free care and screenings to our military and veteran members of our community. Our CARES program stands for Counseling, Advocacy, Referral, Education, and Service. And this is a partnership between the UB Dental School and the School of Social Work that has been around since 2001, I believe, where we've helping our patients get the resources that they need. Give Kids a Smile is another annual event where we give free treatment screenings, also fun educational events to local students and children in our community. Our latest event is Team Smile, which is actually a national nonprofit organization that partners oral health professionals with professional sports teams. So it started with the Kansas City Chiefs, but last year we were able to bring it to the Buffalo Bills for the first time. And what's really amazing here is that this was the first Team Smiles event in the country that incorporated individuals who have intellectual and developmental disabilities. And you can see in the picture on the lower right is our full-time occupational therapist in the dental school. Her name is Elizabeth Thompson, who's been really incredible and doing amazing work with working with this population, but also incorporating sensory adaptive environments, which has been both beneficial to the patients, but also for educating our residents and students and working with this community as well. And then finally, I have to mention the Pedo 801 course, which is a course that I teach to first-year dental students. And what it does is serves as an introduction to the community, its diversity, the oral healthcare needs, and we're giving our students basically an introduction to the community. We have them participate in outreach events. We have them organize their own outreach programs. Some of the ones that were notable this year, we had them give dental bingo at Heathwood Assisted Living and Memory Care. They did education tabling at schools in the Tuscarora Nation and did some volunteering at Friends of the Night for individuals who are unhoused, to name a few. So I will pass it back to you, Gina.
Yes, I don't know what's going on with the screen. So I just wanted to share the activities that we have at IPE. I hope it doesn't move. So we have our IPE. I don't know why it's almost like it's auto moving. I'm not moving it at all. I'm sorry. So we have the IPE activities embedded in our dental curriculum. Right now, our students are mainly participating in the Friday night at AR and the IP forums and obtaining digital batch 1. But we're in the process of working with Michael and Lena in implementing digital batch 2 through a collaboration with dental pharmacy collaboration with the faculty and students from pharmacy. And also some of our students are participating in the digital batch 3 pathway by doing rotations in the Western New York Black Care organization. We're also looking into providing dental services to new partner organizations in the community, and we've been having meetings with some of these organizations, and we're hoping we can participate with our mobile dental unit and also with our faculty and students. And that's what I wanted to share with you. And thank you, Elise, and thank you everyone for listening to us. And now I'll pass it to Jessica. Okay.
Good afternoon. I'm glad to be rounding out this group of amazing folks. Lena, could you just do the next slide? I'm a faculty member in public health and the representative for public health on this amazing team. Next slide. So public health is inherently challenging to be part of interprofessional collaborative teams. Nationally, folks have really struggled with how to implement this non-clinical profession into some of these clinical practices. But here at UB, we are national leaders in this. And from our work, we've actually won honorable mention for 2 years in the Nexus Award in some of what we're doing in the community. Every year I'm invited to speak at IPEC events about how to integrate public health and some of the leadership that we're doing. And I'm incredibly proud of our community-engaged interprofessional education and practice that we are doing with many of the folks on this call. We have been highlighted in all of the national organizations, especially in public health, and continue to be leaders and innovators in this area. Our current achievements is that we have embedded this into our curriculum, and to date, we have nearly 100% completion on all our digital badges. So our students earn 1, 2, and 3. And about 1,300 since 2018 to 2024. We do this by embedding these badges into our courses. So CHB 507 is teams and professional practice, and EEH 590 is a leadership course in public health. Our students earn some of their digital badges during their field training. And field training for public health is 120 hours in which they're placed with a community organization. We are so happy to have such an amazing team in the School of Public Health and Health Professions who not only work to find these placements in the community, but also ensure that our students have a great experience. So we try to do a lot of community engaged interprofessional collaborative practice, and this looks a few different ways. First of all, we have a partnership with Western New York Blood Care that started about 4 years ago. We have 3 programs working with them. The first is the Wister program, which is an immersive experience where students from all of the health profession schools have the opportunity to be on site at this clinic. Western New York Blood Care is a bleeding and clotting disorder clinic actually right across the street from the medical school. Students who go there get to see an interprofessional team in practice. So at this clinic, they have nursing, medicine, social work, dietetics, genetics, PT, pharmacy, and also public health working together to see every patient at their comprehensive clinic. We also have a Health Mentors program, which is based on the Jefferson Health Mentors program. And this allows students to work with a patient over the semester to learn about them and work to create a wellness plan. Finally, as Dr. Woodruff mentioned, we do an innovation sprint, and this allows for the organization to come up with an idea in which they need some help, and our students are innovators. So our students propose possible solutions to these problems that are actually used within this clinical site. We also participate in the Lighthouse Free Medical Clinic. Brian mentioned this of doing school physical days. Here we have public health, social work, dietetics, medicine, pharmacy, working together at this clinic to provide free care to the community. I'll talk a little bit more about our mobile health unit that's coming online shortly, but last but not least, we work at the Seneca Babcock Food Pantry, which is actually an interprofessional food pantry. Our students work together from a variety of health professions to serve this community. And that's really fostered our relationship with this area so that we're able to continue to bring more services to the Seneca Babcock community. So coming May 2025, we will have a mobile interprofessional health unit. And this was made possible by funding from the Mother Cabrini and HRSA funding. This is to do community engaged collaborative practice. We'll be stationed in Seneca Babcock for the first 6 months, but we want all of the health professions and beyond to be on this unit. And not only to be on it alone, but with each other, working towards helping people in our community. We are partnering with the dental school to be alongside them. And along with this large 45-foot unit, we have 2 smaller units, which will allow for us to, one, bring students to the larger unit. It's a 8-person passenger van, and the other is a small outreach unit. And this will allow us to be in more of those tight areas within the city, because this is 45 feet long. We have to be very careful where we're driving this. And I want to iterate, this is not for research. This is for student learning and community engagement. We want to be able to connect the people of Buffalo to the services that they need and help them to navigate our very complicated healthcare system. Thank you very much. I think at this time we're open to any questions.
Jill, how do you typically, wrap up these wonderful sessions? We're very happy to have gotten the opportunity to present all of the amazing things that are being done on the IPE Pathway by your students with your colleagues. And we look forward to many of you joining us as we continue to evolve and offer wonderful opportunities for our students. So thank you everyone for joining us this afternoon, and we look forward to seeing you again out in the community.